Hi everyone. I went to have a PRP treatment a couple of weeks ago, and I've done a video of the treatment itself to show you what happens and how very quick the whole thing is. And if you are wondering, PRP, does that sound familiar? It stands for Platelet Rich Plasma. That is the plasma that is found in your own blood. So yeah, you have a syringe of blood drawn from your arm like you would in a normal blood test. And that is put into a centrifuge for 5 minutes to spin it to separate the red blood cells from the plasma. And it's the plasma, the clear part, which is then injected back into the skin all over your face. And why it's good for your skin is because the plasma is full of platelets and growth factors, and these both help regenerate the skin and boost the production of collagen and elastin. So PRP is what Mr Olivier Amar, the surgeon I went to see at the Cadogan Clinic, calls fertilizer for the skin. Now there's an image to conjure with. But yes, blood. It contains blood, this treatment. So it usually gets dubbed the vampire facial or the Dracula lift or something of that sort. And most people were happily unaware of this kind of treatment until 5 years ago. Kim Kardashian posted a picture of herself after having the treatment with her face all covered in blood, which was a bit of a shocker, and it was misleading too, because like I was just saying, it's the clear part of the blood, the plasma, that is injected back into your face, so you shouldn't end up with a bloody face. These injections used to be done with a mesotherapy technique. That's where you have many hundred tiny pinprick injections into the skin all over the face. But even if you have that done, that wouldn't leave your face covered in blood because the injections don't go that deep. They are just into the surface of the skin. That's all they need to do. But the newest and easiest, less painful, and certainly less fuss way to inject PRP is with a cannula. And that's what Olivier Amar does for me in this video, as you'll see. It's a really quick procedure. And the cannula, which is like a blunt needle, goes in at 4 points on the face, each time through a pinprick hole, which seals itself up pretty fast. So you're done within half an hour and you can go about the rest of your day as normal. And you don't need an anaesthetic, and it doesn't really hurt, as you can see. So what you do see afterwards is a smoothing and softening in the area where the PRP has been injected. I'm 2 weeks on from the treatment, and I can tell that my cheeks are much better hydrated as well. So it's a kind of superior skin conditioning treatment done using your own blood. Obviously this treatment involves needles, so if you don't like needles, well, you probably aren't watching this, but if you are, just to warn you, they are coming up in just a minute. And do let me know if you'd rather, when I did this sort of treatment review, whether I shouldn't show the grisly details, because I mean, I do them like this in order to show what the treatment actually involves, in case you're someone who's interested in trying this thing out for yourself. I think you probably want to see what's really involved, not just a few flanneling words about it. But maybe I'm wrong, maybe it would be better without, but whatever. Drop me a line in the comments and let me know what you think, and I do hope you enjoy the video. Okay, so here I am, at the Cadogan Clinic with Dr. Amar and Vicky, who's going to take some blood, and I am gearing up for PRP treatment, which is platelet rich plasma, and that starts with having blood taken. So here I am squeezing the squeezy ball to get the veins going. Though goodness knows my veins are normally big enough. I'll spare you the actual needle. So you've got 15 mils building up in that syringe down there. I'll still keep sort of fair old distance in case you don't want to really watch too closely. Yep, all good. 15 mils of blood.
Absolutely.
And that's going into the centrifuge.
And the centrifuge will run for 5 minutes.
5 minutes, terrific. Okay, now it's had its 5 minutes in there. The result is...
Here we go. This is where is your plasma. So
Okay, so the plasma is the yellow bit at the top.
Exactly.
Yeah, and then that's the hemoglobin down at the bottom. So as you pull the plunger up, that's the plasma coming up separately. Okay, so now you've got it away from.
Yeah.
Fantastic. There we go. And that's what's going to go back into my face. So I've got to clean my face first to get nice, clean, bug-free surface for the injections. And then you're going to inject with a cannula, as you were saying, which is
Yes.
after the first tiny pinprick is much easier to move around with less pain under the skin than doing dozens of tiny mesotherapy injections, which was the old style way of doing it, wasn't it? And that's an alcohol wipe.
Absolutely.
Yeah. All sterile. Mm-hmm.
Okay, so what we start to do is a tiny micropuncture here. There we go.
Okay.
This is
tiny
all
puncture,
you have.
yeah.
Okay.
And that's the only, and that's just to make the hole, and then you
Absolutely.
put the blunt cannula through the hole.
Absolutely. This is what I'm doing now. You see, there's no pain going
Yeah.
under,
Okay.
and I'm delivering
And then
under
you're
this.
just very easily going under the surface of the skin
Absolutely.
and reaching as far as the cannula can go, really. So you get a sort of fan shape.
Yes.
Yeah.
It's kind of a radius
Yeah.
injection.
Okay.
Could you see?
Yeah.
Good. Very good. Shall we continue on the other side?
So the whole thing's really a very quick procedure, isn't it? Just the taking the blood, 5 minutes in the centrifuge,
Mm-hmm.
and then the injections. And from where you place the PRP, does it then spread further under the skin away
Yes.
from the injection site?
Yes. So you may have a little
So
swelling.
quick. Yeah, but it's fractional. And as you were saying, any swelling, it's not adding volume as such, it's just the volume of the liquid that you put in, and that will disperse itself over the
Yeah.
next few hours, really, won't it?
Exactly.
Okay, so I've got, minimal bit of colour up here from it, and that's all.
Okay. So now there's a tiny one here. So you have to wait to see where is my puncture, because it's very small. Okay.
Mm-hmm.
Done.
And you're just tracing it along underneath. I'm amazed that it's so easy to move the needle under the skin.
Yes, well, because we just entered the dermis.
Okay. That's the hole. And here's the cannula. Because I really can hardly feel it once it's under there, just the pressure.
Exactly. It's finished. Well done,
Oh,
Amas.
okay. Well,
So we have a
fantastic, thank you.
little of weird feeling for
Yeah.
2 seconds, but
Yeah, it does feel a bit weird down the lower.
yeah, it's due to the little
Is it?
pressure.
Okay. Well, there we go. My hand in the right place. So you massage it now.
Yes.
Yeah.
Try to spread the
To
fluid
spread it along. Okay. So
gently.
it'll cover as large an area as possible. And how soon does the PRP, the growth factors, go to work under the skin?
They start like from now.
Yeah.
Probably the first. It may take a few days for you to start to see some slight changement on your textures, on the complexion.
I suppose it takes a while for the skin to regenerate
yes,
itself, doesn't it?
Exactly. I will say about 2 to 3 weeks to
Yeah.
really appreciate the results.
Okay. And what sort of results will I be expecting? A sort of more of a glow in the skin?
Yeah,
or
it's more about the glow.
Yeah.
And all patient mentioned like less dryness, more
Okay,
the glow,
terrific.
the least they need less makeup.
Yeah.
This is the first thing they say. I make up as usual, but I need less makeup, and I find my skin nicer. It's more like you come back from vacation. more rested.
Sounds
So,
good.
we recommend to have another injection in 4 to 6 weeks time.
Yeah.
And every 8 months.
Yeah. Terrific. Thank you.
It's absolutely
I
fine.
like that. It's like that facial where they tackle your face from the inside out.